Hi guys, let's read the question and try to answer it. A 53-year-old woman presents with 4-month history. Okay, of cough, which is productive. There is production of bloody sputum. She denies fever, chills, and night sweats, but has occasional flushing that she feels is secondary to the menopause. Okay, she has had two pneumonias over the last 3 years, two episodes of pneumonia, and it required hospitalization. Physical examination reveals wheezing localized to the left mid lung field. Chest radiograph is normal. Which of the following is the most appropriate next diagnostic step? Okay, read the options: pulmonary function test, pulmonary angiography, fiber optic bronchoscopy, ventilation perfusion scan. Come back to the question. See, she's a 53-year-old woman, chronic cough under, and there is bloody sputum. Okay, we call it as what? Hemoptysis, right? And there is localized wheeze. Yeah, chest x-ray is normal. There is history of recurrent pneumonia. So this combination, guys, this combination of hemoptysis, okay, and localized wheeze, along with a normal chest x-ray, it suggests what? It suggests that something is there in the bronchus. It suggests, let me write it down, endobronchial lesion. Okay, basically there is something inside the bronchus. It could be bronchogenic carcinoma, or it could be a tumor. Endobronchial tumor avam, അല്ലെങ്കിൽ long standing small foreign body avam. So normally the options, right, you might ask, okay, if I'm suspecting that, can I just take x-ray? Chest x-ray, it may look normal in early cases. I mean, the chest x-ray can appear normal in early cases of endobronchial carcinoma, അല്ലെങ്കിൽ airway foreign body if it is small. Early time, basically if there is no obstruction, or obvious obstruction അല്ലെങ്കിൽ x-ray എടുത്താൽ നിങ്ങൾക്ക് ഇത് കാണണമെന്നില്ല. Okay. Anyways, x-ray is not given in the question. Suppose, okay, if one option was chest x-ray, the best option, ഇപ്പോൾ hemoptysis ഉണ്ട്, wheeze ഉണ്ട്, recurrent pneumonia ഉണ്ട്, okay, the investigation of choice will never be chest x-ray, because initially chest x-ray can appear normal in what? Endobronchial carcinoma, or in foreign body cases, if it is a small foreign body that is not causing any obstruction. Okay, anyways, അവർ ഇവിടെ എക്സ്റേ എടുത്തിട്ടുണ്ട്, and that is normal. അപ്പോൾ ഞാൻ പറയുന്നു, in that case hemoptysis ഉണ്ട്, വീസ് ഉണ്ട്, it is a case of endobronchial lesion. Okay, ട്യൂമർ ആവാം, മാലിഗ്നൻസി ആവാം. Now, what is the most appropriate next diagnostic step they are asking? See guys, pulmonary function test നമ്മൾ എപ്പോഴാണ് ചെയ്യുന്നത്? When do we do it? Pulmonary PFT, pulmonary function test, that is to assess the airflow. Air എങ്ങനെയാണ് it's going out and in and out. That is what we are assessing in pulmonary function test. Okay. Here, the patient is not complaining of breathlessness. All the complaint വേറെയാണ്. So definitely it is not pulmonary function test that you will be doing, or that you will be considering as most appropriate. No. Okay. Next option, pulmonary angiography. Pulmonary angiography നിങ്ങൾ എപ്പോഴാണ് ചെയ്യുന്നത്? When you are suspecting, what you will do? When you are suspecting pulmonary embolism, you will do pulmonary angiography. Now tell me, what is pulmonary embolism? What is the definition of pulmonary embolism? It is the acute obstruction of the pulmonary artery. Pulmonary artery അല്ലെങ്കിൽ അതിൻ്റെ ബ്രാഞ്ചസിൻ്റെ obstruction due to a thrombus that has come and lodged in the pulmonary artery or its branches. Okay. Usually, have you heard about DVT, deep vein thrombosis of the lower limb? But DVT of the lower limb, there is one of the complication is even the thrombosis, it can get lodged in the pulmonary artery or its branches, causing a condition called as pulmonary embolism. So that is one indication where you will be doing this pulmonary angiography test. Okay, you don't do it in this case. Okay, fiber optic bronchoscopy. What is fiber optic bronchoscopy? In this, I'll show you the picture. In this investigation, you can directly see the bronchial tree. Okay, you will be putting a tube. Let me show you. Okay, this is a picture of fiber optic bronchoscope. Okay, here you can directly visualize the bronchial tree. ഇപ്പോൾ എന്തെങ്കിലും ലീഷൻ ഉണ്ട്, അത് ട്യൂമറോ മാലിഗ്നൻസി എന്തായിക്കോട്ടെ, നിങ്ങൾക്ക് ഡയറക്റ്റ് ആയിട്ട് ഈ ട്യൂബ് വഴി നിങ്ങൾക്ക് ക്യാമറയിൽ കൂടെ കാണാൻ പറ്റും കേട്ടോ. അപ്പോൾ അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ നമുക്ക് ബയോപ്സി എടുക്കാം, റൈറ്റ്. ഇവിടെ എന്തെങ്കിലും ബ്ലീഡിങ് ഉണ്ടെങ്കിൽ, ബ്ലീഡിങ് ഉണ്ടാകുമ്പോഴാണല്ലോ പേഷ്യൻറ്റ് ഹി വിൽ കഫ് ഔട്ട് sputum, bloody sputum. So if there is bleeding, okay, you can identify the source of bleeding also via this technique. Okay, so the best step here for diagnosis is this one, fiber optic bronchoscopy. Okay, the last option guys, ventilation perfusion scan. Okay, when you're suspecting a pulmonary embolism, that is when you will do a ventilation perfusion scan. So the answer here in this question is what guys? Yeah, you're suspecting some problem in the bronchial tree. So you want a direct visualization of the bronchial tree. So you will do this procedure, that is fiber optic bronchoscopy. Okay, see how simple the question is. Once you understand the concept, medicine is the easiest subject to read.